All right, we're going to get started. All right, welcome everyone. My name is Priyanka Reddy. I'm a health equity organizer at the Southwest Organizing Project. We do a lot of work on the Southwest side. We deploy public health ambassadors, and we've put together a coalition of different community organizations, and they all lead to our bigger title called Healthy Southwest. So today we are honored to have the Medical Organization for Latino Advancement with us today. We have two presenters, and they will be speaking on lifestyle modifications to prevent chronic disease. And they both will be presenting in English from 6 to 7 p.m. and in Spanish from 7 to 8 p.m. Before we jump into the presentation, I just want to go through some housekeeping materials. Today, there is a Q&A function at the bottom of the screen on Zoom, and you can ask questions throughout the presentation. You can also put in anonymous questions, and Drs. Varias and Espiche Salazar will answer your questions at the end of the session. The recordings will also be available at the Southwest Organizing Project's YouTube, and these will be available about 1 week after the session. So if you would like to share with family or friends, that would be great. And if you have any other notes, feel free to message us and we will answer them. So as we get started, I just want to introduce Mr. Oscar Zambrano, the president of the Medical Organization for Latino Advancement. He'll be talking a little bit about their organization.
Thank you, Priyanka. Good evening, everybody. My name is Oscar Ivan Zambrano, and my pronouns are he, him, his. I'm the current chairman of the Medical Organization for Latino Advancement. MOLA is the acronym. We have been in existence for the last 6 years. It's going to be, actually, was just 6 years. During those 6 years, we have grown this organization, volunteer-run, and social justice and equity-driven organization to a membership base of about 1,400 members, most of whom are interested in addressing the disparities that the Latinx community is experiencing in our communities. Most of our base is in Illinois. We have a chapter in Wisconsin, and we have a diaspora already of interested professionals in Latinx health equity across the nation. As you can see here, our mission is, as I said before, very much social justice driven. What we see is that only 6% of the population in physicians in the United States is Latinx. However, the overall population in general, Latinx in the US is about 20%. So 20% of the general population is Latinx, and only 6% of physicians are Latinx. Many of these physicians are subspecialty physicians. So we work for better representation, more access to culturally competent and linguistically concordant care for our Latinx community across the country. But in the Midwest, the necessity of having more Latinx physicians is greater. So we work through two big branches. One is the branch related to leadership. So we were not going to affect change if we are not sitting at the table where decisions are made to allocate resources and to design policy. So we have a more equitable and accessible healthcare system for our community. And the other one is academic excellence. And for that, we provide scholarships, and mentorship is our main ways. We support also the enhancement of more Latinx youth or young professionals in research. So if the faculty is concordant, culturally and linguistically concordant, the students are going to be more inclined to go after that field. So we want more researchers, more leaders, more physicians serving our communities. And we have expanded from physicians only to nurse practitioners, physician assistants, and other healthcare professionals, behavioral health and public health. I myself, I'm a public health specialist. So That's what we do, and that's how we do it. So it's everybody's a volunteer for MOLA. We have a couple of fellowships for leadership and for academic pathways. And we have the scholarships and we have the mentorship. And those are the means to engage with more academic pathways. And running the organization is the main way to work on leadership. Many of our board members have never been members of a board of directors before. And many of our committee leading individuals have are learning the skills of organizing a professional network. So that's what we do. We engage with community through other community organizations, community-based organizations, and we love to provide education and take advantage of our expertise in health when it comes to communication concording in Spanish. And that's in a nutshell what MOLA is. So we invite you to visit our website, is chicagomola.com or molahealth.org, and get engaged in whatever way you can. We are expansive in terms of not only accepting, inviting, and embracing Latinx to be members of the organization, any other member of the community that is Latinx affirming or interested in health equity in general is welcome to join the organization if you're in the healthcare field or you have an aspiration or a dream to be a member of the healthcare professional field. And that's me. That's us.
Thank you so much, Mr. Zambrano. I'm just going to move on and we're going to introduce our two physicians for today. So first we have Edwin Varillas. Dr. Varillas is a general practitioner from Peru, and he's graduated from the Universidad Peruana Cayetano Heredia. He has been working with Spanish-speaking community members on prevention, lifestyle recommendations, and follow-up care of chronic conditions like diabetes, high blood pressure, and mental health conditions. His latest research project about human colonization with antibiotic-resistant bacteria in a tertiary care hospital in Peru was presented last year in the 32nd European Congress of Clinical Microbiology and Infectious Diseases in Lisbon, Portugal. It was being selected as part of the oral presentation session. He gained experience in the United States healthcare system during inpatient rotations in internal medicine, Chicago, Illinois, neuro ICU in Colorado, and outpatient rotations in neurology in Virginia and Washington, D.C. Additionally, he's working on research projects in the neurology field. Our second presenter is Dr. Carlos Espiche Salazar. Dr. Carlos Espiche was born in Lima, Peru. He studied medicine at the Universidad Peruana de Ciencias Aplicadas. He was the valedictorian of his class and managed to work as junior faculty in this institution while applying for medical residency in the United States. He's done rotations at Jackson Memorial, Swedish Hospital, St. Francis Hospital Amita, North Iowa Medical Center, and other prestigious institutions across the states. He has worked at a hospitalist in the Clínica Internacional, one of the top clinics in Peru. He got a diploma in occupational health while working as a primary care physician in an underserved area of the jungles of Peru during the pandemic. He is currently doing his internal medicine residency at the St. Barnabas Hospital in New York and his master's in education by the UPC. He is interested in cardiovascular diseases, community preventative medicine, and patient and community health education. As we move through the session, Dr. Carlos Espiche Salazar will be starting and Dr. Varillas will be following him. So buckle up, I'm gonna go into mute and please drop any questions that you have in the Q&A section and both our doctors will be answering them at the end of the session. So without further ado, our presenters.
Thank you very much for the introduction. Thank you very much, Mola. So let's start with hypertension prevention and all the cardiovascular disease prevention. So Hippocrates said, let food be thy medicine, and is what we're going to begin with. Next slide, please. So one of the diets that we recommend to people to prevent hypertension or even to treat hypertension is the DASH diet, the dietary approach to stop hypertension. The benefits of this type of diet is that it lowers the blood pressure by itself and even lowers the LDL, that is the bad cholesterol. Usually is characterized to be low in sodium and also predominant in fruits, vegetables, and whole grains. Imagine the normal diet in the US is 3.4 grams. It's a normal American diet versus a DASH diet that is around 2.3 grams, and even it can be a little more lower in salt, like 1.5 grams, depending on the goals that we need to achieve. Next slide, please. Thank you. So this diet usually is full of fish, poultry, beans, nuts, rich in magnesium, potassium, also calcium, fiber, and proteins, low in saturated fat, and low in sodium. There are several web pages and several pieces of information that we can get this type of diet. We are going to go through this diet. You will see how this type of diet can change, not just modify the hypertension levels that we have, but also can prevent it if we apply it in our daily life. Maybe we cannot like get the full DASH diet. Maybe it's a little complicated for some of us, but it's going to be something ideal. And even with that, we can apply it in the daily diets or in a daily basis. Next, please. So which products usually imagine a 2000 calorie in a day. Usually the diet or the amount of calories will vary in between different patients according to the weight, according to the physical activities, and also how demanding or which activities they are doing and how demanding they are. But let's see, in a 2000 calories a day, a normal diet, we have grains that it should be in between 6 to 8 servings per day. And one serving is like it says there, 1 slice of bread or 1 ounce of dried cereal or half of cup of cooked cereal, rice or pasta, vegetable 4 to 5 servings per day. Fruits, we have like in between 4 to 5. We can see some of the examples there. Fat-free or low dairy products, like in between 2 to 3 servings per day. We need to put a little more of lean meats, poultry and fish. It's approximately 1 ounce of servings or fewer a day. We can use eggs instead of the meat, for example, too, as one of the sources of protein. We can add some nuts, seeds, legumes also, 4 to 5 servings per week. We can see different type of food that we can use it. For example, 2 tablespoons of peanut butter in the morning. It could be one option, but we must see in the next slides that the type of peanut butter it varies depending of which is the component of this type of slides. So previous one, please. Previous slides. Thank you. So next one, please. So when we go to a product and we need to know like how to read the label and how it's composed, because sometimes I know that we go to the deli or we go to the shop or to the store and we want to buy something, but we don't know if it's going to contain the amount of protein that it was indicated before, or it has the amount of fat or calories that it was indicated before. So when we have a label here, we will have the serving size that usually it can be expressed in cups, maybe in pieces, and also in grams or in the weight of the serving size. Then we will have a part that it says the calories, and this is the amount of calories of the whole serving. So, for example, in this case, we have that this product it has 4 servings per container. So we will have 280 calories per serving, but we have 4 servings. If we the whole content of the package, probably we will have no 280 calories, but we will have around or more than 1,000 calories. If we go to the nutrients, also we will see that we have different type of components according to how much fat, how much cholesterol, and sodium we have in this package. We must read these labels really careful, because sometimes we have too much amount of sodium, for example, something that is for diet, so in the DASH diet that we saw before, we need to maintain a specific goal of salt. So if we consume this type of products without control, we are going to see that at the end we have a lot of amount of salt, and we are going to trespass this goal that we have of, or this limit of salt that we need to be aware of, that we saw in the last slides. The next slide, please. For example, here we have two labels. Both are nuts. Okay, so here we have that one is 160 calories per serving, another one's 170 calories per serving. You will say both look similar. It has a similar amount of calories, but here we have like one of the packages, the one on the left, has sodium 0 milligrams, and the other one is 100 milligrams. So the percentage that is like in the right side of these tables, it expresses the daily value of a 2000 calories diet. So for example, if we eat one serving of the label on the right, we will have 4% of our consumption of sodium approx. That will vary if you weigh more or you weigh less, or you do more activity or less activity. But in a gross way, it will tell you how much of sodium you are consuming per serving by this package. Next slide, please. So the hypertension is one of the chronic diseases that is most common in our population. Across the US, we have to meet some goals, and we know that every year we have more people suffering from hypertension, that at the end will damage not only the different organs like the heart, the brain, or the kidneys, but also will be accompanied by a different type of treatment that maybe will change completely change our lifestyle. For example, hemodialysis, if we have like an end-stage renal disease secondary to the hypertension. So the best way to prevent all this stuff is to try to first screen the hypertension. So who has to be screened? All of those adults that are more than 18 years old. All of them, they must be measured, of course, in different frequency, but all of them, they must be measured at least one time in their life, or one time in some period of time. They will see the next slide. Next slide, please. So there are different ways to implement this screening of hypertension. So we have usually what we do is in the office, we measure the blood pressure, but we confirm it with several measurements after you visit us in the office. So we confirm it taking several measures outside that can be in a clinical setting as an ambulatory patient, or it can be just a home blood pressure monitoring. I know there are a lot of controversy, and most of the patients, when they come to the consult, they usually tell me like, okay, doctor, I know that these blood pressure machines are not accurate. Are they going to be one of the methods that I can use to diagnose high blood pressure? And I say yes, because if we find you, like we find in the office, a high blood pressure in you, and then you go at home and you have measurements on average of blood pressures that are high over one limit that I will mention in the next slides, we can diagnose the high blood pressure or the hypertension. The machines are really good. Usually the best ones are the ones that goes in the arm. The ones that goes in the wrist have less sensitivity at the end. So what we have to do, even if we have the one at the wrist, is to measure several times, and we will see that in the next slides. Okay. So how often? Usually, if you're between 18 and 39, you should do it in between 3 to 5 years. So when you go to the office of the doctor, maybe you have 23 years old, then you will go to your annual meeting with the doctor for different diseases. In between 3 to 5 years, you will have another measure of blood pressure. If you are 40 years or older, the screening will be every year, because you are more prone to have this type of disease. Of course, this will vary in different type of population, and also, of course, if you have other comorbidities that can make you more prone to this disease. Next, please. So when you check your blood pressure, it should be, if you have your device at home, it should be first at the same time, at the same hour, at least resting for 5 minutes, sitting in a chair, trying to not get some caffeine, exercise, or smoking, at least 30 minutes before the measurement. You have to go to the bathroom and urinate before measuring it. It can like stress you, have a sympathetic or mimetic like function, and at the end you will have incorrect measurement. And the idea is that you do it in the same time, the same criteria, and continue like that. Okay. Next slide. The idea is that the machine will usually tell you when is the first sound or the second sound. Usually this information is more when you're taking with a normal or regular one. Usually you have to take at least 2 readings in 2 different occasions to measure an individual level of blood pressure. So when you go to the doctor, I advise you to go with your little chart with all your measurements of all your readings. At least, as I told you, but in one day, 2 readings, at least in 2 different occasions. So every 12 hours is okay. But it must be in the same conditions at the same time. Okay. Next, please. So we, because of the time, we can skip these minutes of these videos. I will let the slides be there. This is a little resume of all the indication that we should use when you have a device. The idea is that the most important thing that I want to highlight in this image is that the arm is always like rested in something, in the table or in the armchair or something like that. Next. One of the things is how high is the blood pressure to say that it's abnormal. The normal level is less than 120. Elevated is between 120 and 129. And the new guideline says that more than 130 is already considered hypertension. Before it was something different. Of course, if at some point you have higher than 180 or higher even than 160, you are considered, or you will be considered probably a hypertensive in the future, because you have like have an initial symptom that is really common in some persons that are hypertensive and they don't know that it's a hypertensive crisis. You must go to your doctor immediately if you have that type of measurements. Even more than 160 is already something that will damage some of the organs. Continue next one. So we have one of the measurements. There we see that at nighttime is different than at daytime. So if the measurements are high, 120s, 130s, at nighttime, of course, they're going to have a different significance than at the daytime. Next, please. One of the ways to, one of the problems that can be linked with the high blood pressure is the stroke. So we can have hemorrhagic stroke, or even non-hemorrhagic stroke. But how we recognize that? There's an acronym that is FAST. So you will see that the face of the person maybe will have like some lip drop. The arms will have like some difficulty or some changes in the strength of one of the hands, or even like a drift of one of the hands. The speech will be a little slurred maybe. And of course, if you see one of those, the FALS, you have to be immediately in contact with 911, because probably if you have one or more, you are in high risk of having like a stroke or being recognized in a stroke. Next one, please. How we recognize a heart attack? Basically, chest pain, discomfort. And they describe like an elephant is in your chest, shortness of breath. Also some pain in the jaw, neck, back, arm, and shoulders, and also feel nauseous, light of head, or initial tired. even when you are like in your 60s or even more than 50 something, and you're diabetic and you have any other disease, sometimes it just presents like a discomfort or heartburn. So the heart attack is something that we must be aware if we have some of those symptoms that I mentioned before, and we think that we are in the population that is at risk of having a heart attack. Usually over 55 in males, over 65 in females. Next one, please. The top 10 recommendations, just to try to get along with the hypertension, try to bring it down. If we lose some weight, 1 milligram of 1 mercury or 1 milliliter of mercury will be per kilo. If we lost 10 kilos, probably we will lose also 10 mmHg. Exercise also will reduce to 5 to 8. Eating a healthy diet like the DASH diet can reduce up to 11. Reduce alcohol consumption, that it goes liquid with the diet, is to 5 to 6. Limit alcohol consumption is even a drop of 4. Less than 1 drink per day in women, less than 2 per day in men. And we see their definitions there of a drink. Next, please. And the last 5 of them is with tobacco. Of course, cigarettes is one of the things that is linked with the high blood pressure. Monitoring the blood pressure at home, the screening is important. Reduce the stress, get a support system. If you have trouble reducing it, go to your doctor, talk with him, do diet in family, maybe that's the best idea to do. And of course, maintain a sleep pattern. Should be more than 6 hours per day, ideally in between 7 and 8. Next, please. And I will let Dr. Edwin to continue with the presentation.
Thank you, Dr. Carlos. Good evening, everyone. I am Dr. Edwin Varillas, and now we will start with lifestyle modifications for diabetes prevention. Next slide, please. So what is diabetes to begin with? Well, a simple definition provided by the CDC states that diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. So in the next slide, we will see that the food we eat will provide us with nutrients such as proteins, lipids, and glucose. And glucose will be very important because we will be able to produce energy from glucose. In order to do so, we need our pancreas to produce insulin. And insulin will work as a key that will allow the entry of glucose into our cells. So when we have a problem in insulin production, we will talk about diabetes type 1. And when we have a problem in the entry of glucose into our cells, we will focus on diabetes type 2. And in this problem, we will have a solution, and that might be prevented or delay in diabetes type 2. And that is what we're going to talk about in the upcoming slides. So in the next slide, we can see that diabetes can be prevented, and that is one important thing to keep in mind. And the early detection saves many lives every day. And well, very quickly, your doctor might consider the recommendations from the US Preventing Services Task Force that suggests screening adults aged 35 to 70 years with overweight or obesity. And we will discuss those terms in the upcoming slides. And your doctor might also consider the recommendations by the ADA guidelines. That is screening everyone older than 45 years or with history of prediabetes or gestational diabetes, and patients less than 45 years of age with both of the following: overweight or obesity, plus one additional risk factor for diabetes type 2, which might include first degree relative with diabetes, being African American, Latino, hypertension, physical inactivity, among others. And all these criteria are known by your primary care physician, so it is important that you discuss all this information with them. These are the 4 screening tests that we use in our daily practice. We have random blood glucose, fasting plasma glucose, oral glucose tolerance test, and hemoglobin A1C, also referred as A1C. Now, if our results came out normal and we are symptomatic, we are still not out of the woods. It is important that we get tested every 3 years. And in patients with prediabetes, they should be tested annually. We have parameters to define prediabetes, basically using the tests we mentioned, and the values above this range would be considered as diabetes, and within this range will be considered prediabetes. Again, all this information should be discussed with your physician for a deeper discussion. Now, what can we do to prevent diabetes? Well, let's begin with nutrition strategies. Here we have the grocery guide provided by the American Heart Association, and it gives us complementary information about vegetables, fruits, dairy, proteins, and the respective servings and cup equivalents. And they also talk about the food we need to limit, avoid, or enjoy. For example, we should limit sugary drinks, sweets, and fatty meats. We should avoid partially hydrogenated oils, tropical oils. We should replace highly processed foods with homemade or less processed options. We should enjoy a variety of nutritious food from all the food groups, and we should keep healthy habits even when you eat away from home. And I really like these 2 lines. It says, food should give you energy, not weight you down. With a few simple changes, you can make eating healthy your easiest habit. And that is something very important to keep in mind. Okay, we have more options about what we should have in our cabinets and pantries. We have options for whole grains, such as brown rice, which I personally love, couscous, we have quinoa, whole grain pastas, breads, and tortillas. This should be stored in a freezer. We also have whole grain flour or cornmeal for baking, options for cooking oils, such as non-tropical vegetable oils, olive, canola, which I use, and corn, nuts, seeds, and nut butters for stir fries and garnishes. They are also very satisfying snacks. And in the next slide, we also have more information about what we should have in our fridge, in our freezer. Proteins, for example, breaded fish fillets, skinless chicken breast, extra lean or lean meats. Tofu is also a very good option. Dairy products, low fat and fat-free milk, yogurt, and cheese. And we should also compare the nutrition labels that we will see in the products. We should choose products with the lowest amounts of sodium, added sugars, and saturated fat, and no trans fat. And we should look for the heart check mark to know all the products that have been approved by the American Heart Association. And we will see an example in the next slide. Here we have the sticker from the American Heart Association. We should look for them next time we go grocery shopping. Okay, so now that we have discussed all the good foods, how can we distribute our plates? Well, the Harvard T.H. Chan School of Public Health shows us this very graphic example of how we should distribute our plate. So the first half should be mostly vegetables. The more veggies and the greater the variety, the better. We also have in the other half, we should split it in 2. One for whole grains. We talk about whole grains, and the healthy protein for the other half. And if we're thinking about healthy oils, again, we have options such as olive and canola oil. And for water, we just have water, or maybe we can have tea or coffee, but always with little or no sugar added. So now, if we are running out of ideas of which vegetables or fruits we should just look for, at the end of the guide, we have this grocery list that we can use so we can easily recognize the foods that we might be looking for today. And we have many options online, but you just have to type down American Heart Association grocery guide, and you will find this one that I highly suggest. Again, we have many options, many grocery lists, and you just have to look for the one that works best for you. Another recommendation that I would like to bring up today is that we need to have more information about diabetes, and sometimes we are running out of ideas of recipes that we would like to try. So I highly recommend this book titled Take Control of Your Diabetes Risk, written by Dr. White. He is the Chief Medical Officer of WebMD. And in this book, we'll find more information, more recipes that we can try. So I think you can look for this book and you will have more ideas of what recipes you might do for the day. Now, this other acronym is for physical exercise. It is very easy to remember. It is FIT, F-I-T-T. So very quickly, F goes for frequency. It is recommended that we exercise 3 or more days per week, but it is okay if we start with just 5 minutes each day and we can start from there. For intensity, it is very important that from those 5 minutes, we can just increase the intensity. So our heart rate will also increase. And in that way, we can maintain our weight or even lose weight if that is our goal. For time, we have to exercise 150 minutes per week, but we can split that in 5 to 10 minutes during the day. For a type of exercise, we have many types of exercise. We can go for walking, and according to the guidelines, it is suggested a reasonable total daily step count goal for adults, it's 7,000 to 10,000. So it's always important that you, during those 5 minutes that you're walking, you might try to increase intensity in order to maintain and lose some weight. Okay, so other recommendations for people that are in their 60s, 70s, and 80s, well, it is important to remember that the older we get, the more active we should be, right? And in this group of patients, falls are something that we will see more frequently. And that is why we should do exercise to improve our flexibility, stretching, doing balance exercise such as Tai Chi. And it is important to try to remember that we have one goal, right? Maybe it is to stay healthy and try to share more memories with our loved ones. So it's important that we also stay motivated. Now we have more options for exercise. We have, for example, duty-free workout videos. You just have to type down workout videos for beginners, and you have many options for beginners. Some do not require special equipment. You can begin with an easy workout video. And I want to give you some suggestions. You should wear comfortable, loose-fitting clothes, use athletic shoes, get familiar with the workout video before starting, stretching, drink water as needed. We don't want you to get dehydrated, rest, schedule days off, talk to your doctor about your workout progress, doubts, or difficulties. It's important that you work with this with your primary care physician because we don't want you to get injured. That is a very common complication. We also have gym workouts. You can work with your personal trainer. You can meet people that can enhance your motivation. And the suggestions are the same. And again, we don't want you to get injured. So it is important that you tailor your physical exercise plan. Now, this section, I titled it Weight Management instead of Weight Loss, because when we talk about weight, we must understand that weight loss is not a universal rule, right? So here we have the weight spectrum. We have that patients might be categorized as underweight because they might be dealing with cancer, dementia, depression, anxiety, HIV, tuberculosis, among other conditions. And they will need a different plan, a different weight management plan compared to people that are in the other polar opposite, people that are in the category of overweight, and they might be dealing with hypothyroidism, depression, menopause, Cushing's disease, and other conditions. So it is important to remember that weight loss is not for everyone. It is just one recommendation for one selected group. So we usually talk about the body mass index. And in this case, we usually use these categories. You can fall in the category of underweight, normal, overweight, obese, or extreme obesity. And you just have to use your weight, your height in square meters, And this is one example. In this case, this patient will fall in the category of obese. Now we talk about all these categories because that is how we can recommend some weight management plans, because overweight and obesity have been related with an increased relative risk of cardiovascular diseases. And this is not the only parameter. We also have waist circumference. And in case of men, when it's more than 102 centimeters, in case of women, when it's more than 88 centimeters, and that is related with higher increase of cardiovascular diseases. And the good news, if we want to lose some weight, if that is our goal, well, even a modest weight loss of 5 to 10% of your total body weight is likely to produce health benefits, such as improvements in blood pressure, blood cholesterol, and blood sugars. So, for instance, if you weigh 200 pounds, a 5% weight loss is 10 pounds, right? Well, that brings your weight down to 190 pounds. And while this weight might still be in the overweight or obesity range, this modest weight loss can decrease your risk for chronic diseases related to obesity. But again, it's important that we talk to our primary care physician, because we must tailor every single weight management plan, and we must consider this when we are setting expectations. Okay, so mental health is very important to talk about, because patients that are either underweight or overweight, they might be also dealing with depression and anxiety. And I want to introduce you to this term that it is weight stigma. That is a form of discrimination based on one person's body weight. And that could lead to decreased psychological well-being and also decreased physical health. So it is important that we, as friends, family, and part of social media, it is important that we make a positive impact in people's lifestyle and not contributing to all of these factors that will change their lifestyles in a negative way. And one tip to fall asleep, I would like to say that many of us make this common mistake of at 9 p.m. we all have our lights on and we cannot sleep by 11 p.m. So one solution for that is in the next slide. If you have trouble falling asleep, dim the lights 2 hours before you want to go to sleep. That is maybe at 9 p.m. so we can just be sleeping by 11 p.m. And bright lights in the morning will make us fall asleep earlier at night. And another recommendation is reading before bedtime. It has many benefits, such as break from screen time, stress relief, improved sleep quality, and long-term effects on cognition. It can prevent or delay conditions such as dementia. And here I have some recommendations for you if you're looking for a book. I like Oliver Sacks. He is a neurologist and a writer. And here you have some recommendations. And well, that's it. That's the end of the presentation. And thank you so much for your attention.
Hi, everyone. Thank you so much, Dr. Despiche and Dr. Varias. If anyone has any questions, please feel free to put them in the Q&A section at the bottom. We will be taking questions right now, and we have our wonderful physicians here to answer them. So let's take an opportunity to take some questions. I have a question for you guys. What is one habit that you kind of foster in your own lives related to, whether it's healthy eating, exercise, whatever, that maybe you could share with the group?
Well, I'm 20 blocks from the hospital, and I have a new habit of going by bike, even in winter or snow. Well, I feel free when I ride, so it's a really good habit. I go by bike every day in the morning, and then I come back with the bike. So it's something that is really nice, and I exercise myself. So I managed to lose some weight with that too. So that's great.
Yeah, in my case, I like to wake up at 5 a.m. in the morning. I belong to that club. And I really like to stay active during the day. And I think that exercising in the morning helps me with that.
Awesome. Thank you so much. I know I personally have a little Fitbit on my wrist, so I love to, track my steps, and that gives me a little bit of motivation to get to that, 8 to 10,000 every day, just to check that box. But also it's like great. And, it kind of motivates you to like push other people in your life to also, get some exercise every day. So what do you think in terms of sleep, Dr. Varias? You mentioned that it's good to get lights off 2 hours before sleep. Do you have any other recommendations related to, some sleep hygiene tips?
Yes, sometimes one of the biggest problems that patients have is how to stay away from our phones. So that is a very important part that we have to talk about when we speak about healthy habits during bedtime. And one recommendation that I can give you is that we should have one place where we can just keep our phones away from us at least 2 hours before we try to go to sleep. So that is another recommendation that I can give to you. It is very important that we stay off screen time. And reading books, that is also a very good suggestion. That is what I'm bringing up today. So there you have it. Yes.
Perfect. Thank you so much. For Dr. Espiche, in terms of cardiac health, what do you think would be the most important change you can make in your lifestyle? Let's say you have high blood pressure. What would you recommend?
Well, the lifestyle changes are several, but one of the important ones is exercise yourself. You're going to lose some weight. Also, it has to be by the hand with a change in diet too. So we can check the sodium that we are eating, and also we can exercise. We saw in the other tables, we will get a little drop of the blood pressure, a significant drop in the blood pressure. Exercise and diet, they're basic for the high blood pressure control.
And would you recommend buying a blood pressure machine to do automatic blood pressure measurements at home?
Sure, as we saw, is one of the methods that we can use to measure the blood pressure at home. I know actually you can help your doctor to track your blood pressure at home too. So if you have one of these devices, you can get like a little chart and put all your blood pressure in the day. And when you visit your doctor the next time, it will be really useful for him to track all your blood pressure for the last weeks. So he can adjust the medication if it's necessary, or you can be part of your own treatment of your own health. Yes.
Thank you so much. Those are all great answers. Dr. Varias, could you give us a little bit of insight in terms of diabetes? Is it reversible? Let's say your HbA1c is 8%. Could you ever going back to being a non-diabetic?
Yes, diabetes is a condition that you cannot cure, but you can treat. So in this case, our levels of A1C might drop if we are following a very good diet plan, or sometimes when we're taking our medication. So it is important to remember that we just can't prevent some complications from that diabetes might have. So that is the goal in our treatment, to prevent the complications that will cause long-term difficulties in our patients.
Thank you so much. I really appreciate it. I do not see any other questions in the Q&A, but I'll give it one more minute to see if anyone has any other questions. Feel free to ask them even anonymously in the box below, and our wonderful doctors can answer them. And we'll just wait another minute, and if not, then we'll jump into the closure. I just really wanted to thank both of you so much. It was so insightful to have your both of your slides and all the questions that you got to answer for us. So it looks like we don't have any other questions. So I will just put up the slides again and share some of the information for next week. So next week, we are really excited to share that the University of Chicago will be presenting. We will have Dr. Deborah Stolberg presenting our English session and Dr. Sonia Oyola presenting our Spanish session from 7 to 8 p.m. We hope that you'll join us. We have a lot of great topics next week, so please tune in. And the last thing I wanted to share was we do have a little bit of information about our own organization called the Southwest Organizing Project. We are located in Chicago Lawn, and we do provide a lot of resources for community members. We currently are doing a lot of work on Medicaid enrollment. It's just been expanded in Illinois to 42 plus, and for seniors, whether you are undocumented or documented. And if for people that are eligible, there's also ACA if you are eligible based on your income. So if you're interested in any of that, feel free to jump on the QR code on the screen. I will also be putting it into the box as soon as I'm done speaking. We also are enrolling people in SNAP benefits. If you have any material needs, such as food, clothing, also feel free to fill out the form. This directly links you to our public health ambassadors, who will be able to get back to you and refer you to one of our local organizations that provide many of these things, such as behavioral health, counseling, employment opportunities, even city key IDs. So if you're undocumented, you can get a city key ID card, which will help you get to a lot of resources around the city. We also have legal aid, citizenship, and DACA efforts, as well as healthcare, housing, vaccination, violence prevention, and mentoring. So please feel free to connect yourself to some of the resources that we have. And we do have English and Spanish speaking public health ambassadors that are able to help you with these referrals. If you have any questions, feel free to email me as well. My email is at the bottom. It's preddy@swapchicago.org, and I would be able to connect you or answer any of the questions that you may have. Thank you so much, everyone. Thank you for tuning in. Thank you to Doctors Varias and Carlos Espiche for being with our session today. If you are staying or you just tuned in, we will be starting the Spanish session in just a few minutes. And of course, thank you to the president of MOLA, Mr. Zambrano, for tuning in and helping us find physicians for this wonderful session. So have a great day, everyone. Have a good evening. And thank you so much for tuning in.